5 organs and their anatomical counterparts. One of the most common and challenging questions often received at a TCM clinic is, "My husband says his liver is not in good condition. What should we do?" The problem here is that the liver the patient refers to is not the same as the liver we refer to in TCM. When patients say their liver is not in good condition, they are usually thinking of the reddish organ on the right side of their abdomen, responsible for detoxifying the body and causing fatigue when overworked. However, the liver in TCM is a completely different entity. In Western medicine, organs are defined as tangible entities. If there is no physical structure, there is no name assigned to it. In Chinese medicine, however, organs are not defined by their physical form, but rather by their functional roles. This is akin to how departments in a company are defined not by their physical location, but by their scope of work or function. For instance, regardless of changes in physical space, such as the 3rd floor, 4th floor, West Wing, Richard, or Jane, the finance department or general affairs department continues to exist as functional entities. For example, in Chinese medicine, the liver refers to the organs or systems within the body that possess the energy or essence of wood, mu. It does not refer to the liver as a palpable physical organ. A common question arises: why is the brain not included as one of the primary organs in Chinese medicine? And how does Chinese medicine treat brain-related diseases? The questioner is referring to the tangible, physical brain. In Chinese medicine, the emphasis is placed on the function of the brain rather than its physical structure. The brain's function is closely related to mental activity, which in Chinese medicine is primarily governed by the heart, a functional system responsible for the energy of fire, heart system. In essence, the 5 Zhang organs in Chinese medicine represent metaphorical systems that describe the primary functions of the human body. Their existence is not tied to the presence or absence of physical organs. While Western medicine views organs as physical offices, Chinese medicine regards organs, particularly the 5 organs, as divisions of the body's essential functions. Therefore, regardless of the discovery of new organs in the future, the framework of the 5 organs in Chinese medicine can encompass and explain all such findings. Liver. The liver is responsible for the smooth flow, distribution, and excretion of qi. When liver qi flows smoothly, emotional activities are stable. If not, it can lead to anger or depression. Conversely, frequent anger or depression can negatively impact the liver. The liver also stores blood and regulates its volume. Heart. The heart is closely related to mental and conscious activities. When qi and blood are abundant, the mind is clear and the spirit is agile. Conversely, if qi and blood are deficient, mental confusion, frequent sadness, and irritability may occur. The heart also performs the function of circulating blood throughout the body. It is connected to speech and sweating and has a relationship with the tongue, where symptoms can manifest. Spleen. The spleen is responsible for absorbing nutrients and supplying them to all organs and tissues in the body. It also ensures proper fluid metabolism and excretion. The spleen is related to the limbs. If nutrients are not adequately supplied, the limbs may become weak, thin, and cold. It is also connected to the mouth. When the spleen is healthy, there is a good appetite and the lips are red and shiny. When the spleen is weakened, appetite is lost and the lips become dry and lackluster. Lungs. The lungs govern qi and are primarily responsible for respiration, taking in clear air from outside and expelling turbid air from within the body. They are connected to the nose and are responsible for sending clear qi downward. The lungs also have a close relationship with the skin and body hair. Kidneys. The kidneys store all essence, jing. This includes prenatal essence, which is responsible for reproductive functions, and postnatal essence, which consists of nutrients absorbed from food. The kidneys govern both types of essence. Additionally, they regulate bones and body fluids and have a connection to the ears. 5 organs and their anatomical counterparts. The heart, lungs, and kidneys are relatively straightforward to understand because their roles in traditional Chinese medicine closely align with their anatomical functions. For example, the heart can be associated with the cardiovascular system, the kidneys with the urinary and reproductive systems, and the lungs with the respiratory system. In contrast, the liver and spleen differ significantly in their functions and interpretations in TCM compared to their anatomical counterparts. Below, I will provide a concise summary of the primary functions of these 5 organs from both TCM and biomedical perspectives. This comparison is meant to give you a general impression of each organ in TCM, but keep in mind that these connections are not direct equivalents and are provided solely to aid your understanding. In traditional Chinese medicine, the lung is best understood in terms of both the respiratory and immune systems in Western medicine. Therefore, the lung system in TCM includes not only the lungs on both sides of the chest, but also the airways and the diaphragm. Additionally, structures involved in the primary immune response in the respiratory system, such as the adenoids, tonsils, and lymph nodes, are also part of the lung system. The lungs are considered the uppermost organ among the 5 organs, and they are said to be the first to encounter pathogenic factors. This is not merely a metaphor. Within the lung system, the skin and the intestines are included, as they play roles in the first line of defense by interacting with external substances. This makes the lung system in TCM quite comprehensive. In TCM, the kidney is closely related to the urinary and reproductive systems in Western medicine. It is intricately connected to the production and excretion of urine. Additionally, organs and functions associated with sexual activity, such as the testes, ovaries, and prostate, as well as endocrine functions related to reproduction, belong to the kidney system in TCM. The kidney is also strongly associated with the bones, making it a focus of treatment for degenerative bone diseases and osteoporosis. In TCM, the heart corresponds to the cardiovascular system in Western medicine. Thus, conditions like angina, myocardial infarction, and arrhythmias are all seen as issues of the heart. The brain's functions are also associated with the heart in TCM. The heart is considered the organ that governs mental activities and is the most superior organ in this regard. Also, cerebrovascular diseases are also classified as heart-related problems in TCM. Mental activities such as cognitive function, orientation, and memory are closely linked to the heart. In TCM, the spleen differs entirely from the Western concept of the spleen. It is believed that during the early introduction of TCM to the West, this organ was mistranslated. The spleen in TCM is most closely related to the digestive system, including the esophagus, pancreas, stomach, duodenum, and the functions of all the intestines. Issues such as poor appetite, overeating, or diarrhea are associated with the spleen in TCM. The liver in TCM is challenging to align directly with a single system in Western medicine. The liver's primary function in TCM is to regulate the flow of QI. It is closely related to emotional expression. The liver also stores blood, playing a key role in blood distribution and regulating menstruation. Although the liver shares similarities with the heart, there are some differences. The liver primarily deals with blood deficiency, while the heart focuses on circulation. The liver is more connected to emotional expression, while the heart is associated with cognitive functions. Additionally, the liver is linked to the sinews or tendons and is responsible for the strength and function of muscles. 5 organs association with 5 phases are just metaphors. The association of the 5 organs with the 5 phases is purely metaphorical. Avoid forcing anatomical organs into the 5-phase system or attempting to explain overly stretched theories. The names of the organs serve as symbols and metaphors, with the focus placed on their functions rather than their physical entity. Don't be tricked by their names. As shown in the table, many pre-Han Dynasty texts assign the 5 organs to different elements within the 5 phases, wuxing. For example, the famous Taoist text Huainanzi assigned the lungs to fire, Guanzi assigned the liver to fire, while the Huangdi Neijing assigned the heart to fire. We simply follow the system outlined in the Huangdi Neijing. The 5 organs are merely names associated with the 5 phases. In traditional Chinese medicine, We refer to the organ with the qualities of fire energy as the heart, but this is not the anatomical heart. Whether we call it fire energy, the liver, or the lungs instead, it does not fundamentally change the concept or clinical application.